Hoće li ova muzika sama da se ugasi ili? Jeste, jeste. Strašno. If we can take our seats, please. Okay, so I hope you enjoyed your lunch, but I also hope that your focus has not disappeared, given that we still have to present two partner universities and their two extremely interesting challenges. Now, I would like to ask our dear colleague Victoria Nagy to introduce us to the challenge of the Université Paris-Cité, creating an eco-responsible hospital. Victoria, yes?
All right, so hello everyone. Here is our challenge, which was entitled Creating an Eco-Responsible Hospital. First of all, our team, I would like to thank Nicholas and Clara, okay, who were our coaches, mentors on our challenge, and of course myself, but I'm not going to thank myself for that. Right, but I hope the students will. Now, let's talk about the challenger. Okay, so we created this challenge together with the Paris Hospital Federation, which encompasses 38 hospitals, meaning more than 100,000 employees, so a huge amount of employees, and actually it is the largest employer in the Paris region. And they, of course, provide medical care, but also education and do research. At the same time, they take care of 8 million patients a year. So a huge, huge, huge institution. Now, what was our challenge about? According to the World Health Organization, climate change represents the biggest threat to global health nowadays. And at the same time, we should not forget the Hippocratic Oath states that a doctor's job is to do no harm. Well, actually, in France, the healthcare industry is responsible for 5 to 8% of CO2 emissions, green gas emissions, and that's exactly what it is, doing harm. So, as you know, so the hospital consumes a huge amount of energy. More than that, it actually is responsible for emitting hazardous waste. More than that, actually, this hospital federation produces 5 times more household waste than the whole household waste production of the wider Paris region, right? So there is a huge harm done by the hospital system. Hence our challenge, which I'm not going to elaborate more on. I will let our students to explain the pain points and the solutions they have found. So first up is Leila from Humboldt University, who is representing our first team. We have 3 teams. And our first team is the Planeteers.
Good afternoon. I'm Leila Khalid, and I'm representing the Planeteers. We love food, but we hate waste. That's why we've designed Foodigachi, a data tracking tool for hospitals to become more eco-responsible. We're the Planeteers. We're a group of 5 people Nyota from UC Louvain, Natasha and Daria from King's College, Nadine from Aarhus University, and at the helm of our ship, Vicky. Let's take a closer look at the problem. Within the French healthcare system, food waste releases 2.8 metric tons of carbon dioxide. That's like driving around the world 3 times in a fuel-based car. There is no measurability, so there is no accountability. That means hospitals in France fail to meet patients' dietary needs and fail to meet carbon neutrality goals. In order to rectify this issue, communication, measurability, and accountability must be improved. Food waste is also related to hidden financial losses. Sorry about that. At Necker Pediatric Hospital in Paris, of the 1,700 dishes, around 30% are not eaten or tossed into the trash. That translates to a financial loss of 360,000 euros per year from the food budget. Now multiply that by 37 other hospitals, and that is just Paris. My team has devised a solution. Foodagachi, which will not only solve the problem of hospitals' food waste management, but will also improve the hospital experience for children. Introducing Foodagachi, a groundbreaking software designed to revolutionize the way pediatric hospitals combat food waste while empowering their young patients. Our platform encompasses 3 key objectives that will transform the hospital's experience for both staff and children. Second, Foodagachi offers an engaging and entertaining learning platform for children. Through interactive games, educational content, and personalized avatars, young patients learn about nutrition and the importance of reducing food waste. The immersive experience fosters a positive relationship with food while empowering children with knowledge and responsibility. Finally, Foodagachi provides hospitals with comprehensive data on food waste. Our anonymous reporting system categorizes data by ward and/or age group, enabling targeted interventions and informed decisions to minimize waste effectively. This valuable information helps hospitals optimize their food management strategies and make impactful changes. Foodagachi combines data tracking, education, and actionable insights to create a solution that improves food waste management, enhances patient experience, and promotes sustainable practices within a healthcare facility. Let's take a closer look at how Foodagachi works. Foodagachi is simple. After being introduced to the application, patients simply eat their meal, input their information into the app, and nursing staff checks. The catering staff. The data then goes directly to the kitchen staff who can take suitable actions to reduce waste and meet their goals. The management level. Finally, the entirety of the data gets analyzed at a management level where, through the use of filters, they can identify patterns such as food most wasted, the days on which food is mostly wasted, and finally, from these data, management can pinpoint their specific problems and find solutions that are specific to them. You might be asking yourself how we've connected our Foodagachi to the UN Sustainable Development Goals. We've pinpointed 3. Sustainable Development Goal number 3, good health and well-being. Foodagachi promotes healthy choices, well-being and food security for children. SDG 11, Foodagachi will help Paris hospitals visualize their 2025 decarbonization goal of becoming more sustainable city and community. And last but not least, SDG 12. Foodagachi establishes accountability and helps hospitals reduce waste by prevention and reduction while promoting sustainable lifestyles, which ultimately leads to an overall reduction of GHG emissions. Help us combat food waste and promote sustainability while giving young patients a positive and enriching experience. Let's make a big impact on children's well-being and the planet. Are you ready to join the Foodigachi revolution? Thank you.
Okay, now time for jury members. Do you have any questions, maybe?
Okay, so thank you very much for your presentation. How are you planning on engaging the whole staff? Because nurses are really busy, you know, and they need to kind of validate the data, as I understood, after the children put it in there. And also, I really like the fact that you're trying to collect a lot of data for the hospital, because I think that also this would be the right way to go. But it can be super difficult to implement also for the kitchen staff. Don't they need, like, how are they going to change their behavior on a day-to-day basis? I felt like there was missing some kind of a bridge there for them to use the data. Yeah, thank you.
So in terms of accountability and staff checking, this is really a procedure that can even be done by parents. It's really just to make sure that the kids aren't fibbing or trying to put in an extra food group that they maybe didn't eat so that they can get a reward, because our avatar actually grows a crown if you eat healthy food, and we all know kids like to see that happen. The second part of your question pertains to the kitchen staff. The kitchen staff receives real-time data, and based on our pilot hospital, we understand that the food is not made in-house, and that there is a specific body responsible for creating healthy meals and healthy menus, and they will be the decision makers on how the menu changes based on the food waste that is created through the children. But it is still important for the kitchen staff to kind of get an idea, because they are the ones on the ground, they are the ones serving the meals, and they are the ones plating that food that is being delivered to them. So in case the hospital wants to develop their plans further, the kitchen staff has accessibility and accountability.
Thank you very much for a really engaging presentation. I wanted to build on this question because that was a question I had too. And part of that I was also wondering, and you started talking about having a pilot hospital. I was wondering what kind of user feedback you'd gained on this, and sort of whether children are going to put this data in and for how long, like how entertaining is it over time and so forth, and the other actors in the system too.
So we actually talked to the experts at Necker Hospital, and due to data security, we were still not allowed to test run with patients. We would have to do it with a data set of specific anonymous children, or just people that are using the app. But through feedback from Necker Hospital, we believe that the patients would be very interested, because they are children, they're in a hospital, they're already bored, and this can provide them with a little bit of spice to their life, let's say. So I hope that answers your questions. Anyone else? Yeah?
Yeah, I was just wondering, what's the percentage of children in PHP or other hospitals? What's the percentage of children compared to the general population in the hospital? Do you know? To know what would be the impact in terms of food waste and so on?
So this specific hospital is completely pediatric, but for app PHP, I'm not actually sure. I would have to defer to my team lead, who has more statistics on that one. But the hospital we chose is pediatric, and we chose it specifically because it's children, and pediatric hospitals have higher waste because in terms of food, because children are picky eaters and may not necessarily want to eat what is served to them, even though it is beneficial for them. I hope I answered your question. Thank you for listening, and thank you very much, Vicky.
Thank you.
Great job.
Okay. Moving on to the second team that was solving Paris Challenge, EcoOR. There. Okay. Here you go, girls.
Good. Thank you. It's here. You keep it? Keep to you. Okay. Good morning. Sorry. Good afternoon to everyone. We are EcoOR, and today we are EcoWing, and today we are going to present our plan to make operating room more sustainable. Did you know that OR represents 20 to 30% of total hospital waste? Currently, 20 to 50% of drugs are being prepared in ready-to-use syringes, but not administered at all and discarded, still untouched. But what if instead of wasting the unused drugs, we could make it more sustainable? Let's start with the problematic itself. Every time there is an operation, there is a waste of drugs because once the drug is in a syringe, it is considered used and therefore it is destroyed. On average, there are between 1 to 2,000 operations per hospital per year in France, according to a Senate report, so I can let you imagine the amount of waste that is realized each year. This also causes glass and plastic waste because of drug containers and more pressure upon medical workers because they are the ones preparing and administrating the drugs. Thus, hospital pollution is only increasing with the financing of drugs and pressure upon medical workers as well. That's why EcoWing came up with the idea of a green distributor in OR, specifically aimed for the pediatric department. I will let Nala present it.
So how does EcoR work? Think of EcoR as a coffee vending machine, but instead of having coffee, we have drugs, and instead of having cups, we have syringes. Practitioners, through a digital interface on the machine or through a tablet, can input the drug dosage required for the operation, and EcoR will effectuate the filling of the syringe in a timely manner. In terms of technical aspects, EcoR focuses on industrial drugs and stored at room temperatures and can store up to 5 different drugs. Practitioners can choose which type of industrial drugs to store within EcoR. To get the requested drugs dosage in a syringe, EcoR goes through a simultaneous process in which on one side we have the labeling process and on the other side we have the storing of the drugs in the syringe. Within the labeling process, first, the desired drugs will be attributed to its specific color-coded stickers, and then the name and the dosage of the drugs will be printed with a thermal printer laser on the stickers. Once both processes are done, the sticker is sticked into the filled syringes. Practitioners like cleaning assistants can quickly clean EcoR without requiring any extensive training, and a software can also alert the staff when EcoR needs to be cleaned or refilled with a specific set of components. The software will also collect and track the data and allow practitioners and hospitals to track the actual drug usage and be also alerted in case of errors. We hope to develop EcoRs to distribute the drug ready to use within 10 to 20 seconds, but we also hope to shorten this time as we further develop EcoR. Now I'll let my partner Jimmy talk.
EcoR is a sustainable option as it generates less plastic and drug waste, and is also cost-effective as it shifts from buying small bottles of drugs into containers of drugs, significantly reducing the cost of drug purchase in the long run. After the product development stage, we aim to reach out to 2 main investors. First is medical device venture capital firms, such as Y Combinators, where EcoR can utilize the seed funding for further development. Second is using government funding. We have looked into grant opportunities, which is much better for us and much less risky for the initial stage. To elaborate, in the UK, medtech funding mandate by the NHS could be a feasible option, as EcoR is suitable for the criterion of being effective, cost-saving, and affordable. Moving on to our business and sales strategies. We aim to implement the subscription plan, where hospitals' recurring payment will allow us to have a stable revenue. We will also act as a bridge between the hospitals and the drug manufacturers. Ongoing supply chain problems of anesthetic drugs in hospitals would be reduced, as hospitals will not be required to contact the drug manufacturers directly. The scheme would be especially beneficial for smaller-scale surgical centers. EcoR will allow hospitals to obtain drugs in a reliable basis and avoid occasional shortage problems. To sum up, EcoR allows us to be waste-free by producing less drug and plastic waste, saves time, and makes it easier to track actual use of drugs. By rethinking the problem of drug wastage, we can reduce it and be EcoR responsible. Thank you.
Thank you. Okay, now time for the jury. Do you have maybe some questions for the girls?
Thank you very much. That was very interesting. Nice pitch. So one question concerning drugs, right? There has to be a traceability. You know, lot numbers, it has to be sterile and so on. Have you thought about how you actually are doing the actual deposition in the syringes?
So you want to know the mechanism?
Yeah, whether you're sure about traceability.
Well, actually, our machine will be working with a software inside it. So whenever like the practitioners are using it to administrate a drug and to take out a drug, it will be collected, like the data of it will be collected. So we will know which kind of drug and how much has been used. And this is the traceability of data that we are implying. Thank you.
Thank you very much for a really interesting problem and solution. The part that I hadn't quite understood is in the problem, so you were saying that syringes are filled in operating theatres and they're not used. What I would like to understand further is why are they not used, and why does then having this kind of vending machine approach prevent that problem? Because I haven't quite understood the link, because I could see you using a vending machine and still having this problem. So if you could just explain that little part to me.
Thank you for the question. So most of the drugs prepared in OR are emergency drugs, and the dosage is always 20 millimeters from what we gather from specialists. But the dosage varies from patient to patient, and depending on the operation and how it's developed, not all the drugs are used or just like discarded. So they will prepare the drugs at the beginning of the operation, but it's not certain that they are going to use it. I hope that responds your question.
So the thing I'm not clear about is why would they be willing to not prepare them at the beginning of the operation and just wait until they need it? And I know you said it's only 20 to 30 seconds, but in an emergency, that might be a long time. I don't know, I'm not a doctor, but I was just wondering about that part.
Well, most of the drugs that they use in case of emergency are inhibitors. And what the expert told us is that the drugs are put in a syringe, and it's a injecting kit that is actually prepared, and that most of the time they don't end up using this kit. So I believe there was a percentage up to more than 60% of wastage with that emergency kit, and that's why we thought about this machine, because even though it will take 20 to 30 minutes, whenever there is, like, the doctor will feel like it can go wrong, they can directly go and click on the machine, and there will be less waste, you know, rather than preparing a whole kit and then throwing it away. Thank you for your question.
Yeah, I don't know if it's a question. This might be more of a comment. But I think that it would be beneficial with a small animation as to how this vending machine would work, because it can be a bit difficult to imagine, just to give people a better understanding.
Well, can I reply or? Well, actually, while making the drawings, we understood that they couldn't be like one type of machine. So we had like multiple prototypes. But for today, we choose only one, and it's real that it's not that easy to understand with the illustrating, but I think it's more of a technical issue, because we don't really know like what kind of mechanism would be the best one and the faster. So that's why we just implemented a a basic illustration, but yes, thank you.
Okay. Thank you very much for your questions. Thank you, girls, once again. You can wait here, yeah. And at last but not least, let's hear a presentation from the third team that was developing a solution for this challenge, eTrack. It's the only one that we have. That's what Victoria sent me. Yeah. Little delay, we have a new presentation at last minute.
So, hello everyone. We are the eTrack teams and we hope to bring change to the hospital system. So, since October, our team have been working on one question: how to make hospitals more eco-responsible. So, we know that hospitals are a major part of society. We know that when you are sick and in need of assistance, this is where you go. It is therefore where quality is really important and when it needs to be maintained. In order to deliver quality care for the patient, hospitals use a variety of medical devices. But first, what do we mean by medical device? A medical device is a tool that is used to provide a therapeutic solution and not counting on immunology, pharmacology, and metabolism. They are often used to support surgical and medical procedure. Therefore, these devices are necessary and hospital cannot operate without them. For hospital, it is impossible to equate environmental consciousness with disposing of the single-use plastic only. It's much more complicated than that. Caring for the planet is not only diminishing the quality of patient care. As we all know, other industries are governed by supply chains. Supply chains, production, and transporters are a big pollutant. So, on the contrary, we don't really know what happened to medical devices when they are inside the hospital. So, if we take the problem, the example of an ultrasound system, we know that it's an assembly of different parts, such as a printer, a display, or a transducer probe. Some have high viability, others don't. Some parts are considered waste as soon as they are damaged, and while others can be reused. The problem lies in the following. Even if hospitals wanted to make conscious purchase, they can't really know where to begin because there is too much information. And then, even if they happen to buy a great product, it is hard to keep track of the waste, the energy consumption, and the maintenance cycle. So this is why we created eTrack.
So yeah, thank you, Asa. So based on our problems, we have thought about a solution in last November. So one thing you must know is that hospital supplies are important for the living of the hospital. So they need medical devices, medicine, food for patients. So we thought about eTrack. eTrack is a tracking system that measures the environmental impact of the hospital by empowering the hospital. So how do we plan to make this possible? We thought about the KPI, which is the performance indicators that is going to provide the hospital to make a more sustainable decisions and therefore encourage the suppliers to also make a decision, because if the hospital decide to buy more sustainable devices products, then the suppliers are also kind of like forced to make a change too. So our unique values are, first of all, this system can bring, it's really cost effective, and it's low cost, and it's also bring relevant information for the hospital to make a change and raise up. It's also scalable. It can be at a low cost, a small scale, and also be big if the small scale goes well. We can eventually think about a bigger scale. Sorry. It's also easy to implement. So you must be asking, how do we plan to make this? Well, first of all, in the first place, we plan to bring investors in, and then, no, first of all, the first element that really is important is that the hospital, the investors, a lot of actors, they need to collaborate together to really bring the change possible, because without a collaboration, there is not going to be a change. So first of all, we plan to bring to contact investors and then do a testing of the KPI and also promote it on the market to encourage the promotion and the adoption of the products. So yeah, based on the feedback of our experts, we decided to redirect our solutions.
As Sandra just explained to you, eTrack was originally a software designed to track the progress of medical devices inside hospital. But we realized that it cannot be feasible because one, hospital don't track progress and data on the environment, and therefore we cannot know the impact of medical devices. Then it will be hard to build a whole new system of trackers for every single devices, because as we know, there are many systems in one hospital. So we try to, after some research, we heard about the PNAD. It stands for National Action Plan for Sustainable Government Procurement, made by the French government. It's a plan that try to provide buyers, in all cases hospitals, with ergonomic digital tools to help them take social and environmental consideration into account. If we can shift eTrack from being a software to a marketplace, we think that it will be great for the hospital because they will then know how to purchase consciously. Because in the new version of eTrack, the KPI are used like categories, and each of the categories have a score. And based on that score, hospital can know where to put their money, basically. So you will have a category for energy, production, transport, and maintenance. Because we know that hospital can try to be more sustainable, but they have limited funding. So we think that eTrack can become a huge marketplace where one puts the emphasis on sustainability by implementing transparency in the manufacturing process, the transport, the maintenance, and the energy consumption. Our team tried to make an efficient and innovative way of tracing the impact on medical devices, because we want to make a positive impact for the health sector in general. We have to remember that the hospitals are caring for patients, but our biggest patient is the planet. Thank you.
Thank you. Okay, maybe some questions, but please let's keep it short because we don't have much time, unfortunately. Anyone? Tamara?
Hi, congratulations on your solution. Can you just in brief give us the example of one medical device and how would the process go?
Yes, of course. We use in the presentation the example of a scanner. When a scanner is produced, it can be produced by different brands. And how do we know which one to choose? There are scanners producing in France, in China, all over the world. It's like the focus with eTrack is to know how is it truly manufactured. We know that there is transport costs and maintenance. For the hospital, these are big points to know what to purchase.
Okay. Thank you once again. Okay, now let's hear what their challenger, for whom the students develop solutions, thinks about all of this.
Hi, I'm Stéphanie Sigaud, a passionate anesthesiologist and critical care specialist working at University Hospital Beaujon, a proud member of Université Paris-Cité. I am honored to be a part of Circle U Challenge creating an eco-responsible hospital as an expert. Cooperation between my institution and the academic community is invaluable. By joining forces, we unlock a wealth of knowledge, experience, and innovative ideas that can revolutionize the healthcare industry. Local and international academic collaborations foster a dynamic exchange of ideas, enabling us to push the boundaries of medical research, education, and patient care. Through these partnerships, we may gain access to cutting-edge technologies. By sharing our experiences and insights, we inspire and empower future generations of healthcare professionals. We foster a culture of continuous learning and growth, not only within our institution, but also across the academic community. The Circle U Challenge program is an incredible journey, brimming with enthusiasm, innovation, and collaboration. My partnership with the passionate student teams that took on our challenge has been nothing short of inspiring. Their fresh perspectives, creativity, and dedication injecting new energy into our pursuit of an eco-responsible hospital. The student team demonstrated exceptional problem-solving skills, thinking outside the box to devise a sustainable solution tailored to our specific needs. Their unwavering commitment and drive to make a difference are truly remarkable. Their passion fueled our motivation to create an eco-responsible hospital that will serve as a beacon of environmental consciousness in the healthcare sector. Their proposals were not only feasible, but also aligned with our vision of providing top-quality patient care while minimizing our ecological footprint. I firmly believe that the value of cooperation between institutions like ours and the local and international academic community cannot be overstated. Through such collaboration, we unlock new horizons, spearhead groundbreaking research, and nurture a generation of compassionate healthcare professionals. My experience with the Circle U Challenge program has reinforced my belief in the power of collaboration. The dedication, ingenuity, and passion demonstrated by the local university and the student teams have left an indelible mark, and I am immensely proud of the outcomes we have achieved together. Let us continue to embrace the spirit of cooperation, innovation, and sustainability as we forge a brighter, eco-responsible future for our hospitals and our planet. Thank you.
Okay, thank you. Let's move on to the last partner university, and it is my great pleasure to present King's College London and their challenge Improving Mental Health for Lambeth Residents, for which there was a huge student interest from the very beginning and for which the largest number of creative solutions were actually developed within the program, which we will now get to know. So I would like to invite my colleague Kristen Kommer to join us and say a little more about this challenge.
Yes, hello. So our challenge was improving mental health for Lambeth residents aged 0 through 25. And we worked with two partners for this challenge. The first is South London and Maudsley Foundation Trust, which is an NHS provider, and it's actually the provider of the widest range of NHS mental health services within the UK. And they aim to be the leader at improving health and well-being, both locally, nationally, and globally. And then we also worked with the Lambeth Borough of London Borough of Lambeth. And Lambeth is a diverse and densely populated borough in southeast London with a large young population. So 63% of residents describe their ethnicity as other than white British. There's 10% of the Lambeth population identifies as LGBTQ+, making it the highest proportion in London boroughs. And Lambeth also has 64 areas of parks and open spaces. However, mental health is a significant challenge in the London Borough of Lambeth, and there is high demand for mental health services within the borough. There are around 92,000 children and young people under the age of 25 that live in Lambeth, and roughly 1 in 5 adolescents report mental health problems within the borough. And also, the rate of hospital admissions is higher regionally and nationally. While data on the impacts of the COVID-19 pandemic are still emerging, the NHS did conduct a survey and found that mental health difficulties in children and young people have actually increased to 1 in 6 children aged 5 through 16, compared to 1 in 9 in 2017. And so we've asked students to be creative and draw on various techniques, technology, and interdisciplinary knowledge to create innovative responses. And after all these presentations, you'll actually hear from one of our challenge partners, Dr. Crispin Day from South London and Maudsley Foundation Trust. But I did also want to share some feedback from our other partner, Sabrina Phillips, who is the director of the Lambeth Living Well Alliance, on our finalist teams. And she said, "I was impressed by the enthusiasm of each group and that they worked together to harness the expertise within their groups to put forward a solution to benefit the population of Lambeth." Well done to everybody that took part in the pitches. So without further ado, I will turn it over to Abby and Akira to present their solution, Wandering Emotions, here with us live today, and then we will watch the recordings.
Thank you very much, Kristen. Okay, so now, guys, It's that. Here's the mic. And here's the pointer.
Hello. We're excited to showcase our project Wandering Emotions to you today, the winning solution to improve mental health for 0 to 25-year-olds in Lambeth. So there are 92,000 children and young people living in Lambeth, a borough in South London, and 1 in 5 of these report mental health difficulties. Wandering Emotions aims to reduce this burden by providing families with the opportunity to engage with nature and discuss topics of mental health with trained volunteers and professionals. Evidence shows that walking through nature can increase well-being, so we have developed our program in parks in Lambeth to create a calming environment for children to feel safe compared to talking online or the formal structure of an office. Wandering Emotions walks will have designated stops with evidence-based activities and techniques designed to understand and communicate emotions and increase well-being. For example, the 5 senses check-in and breathing techniques, which help to ground yourself and reduce anxiety, and using animals such as lions makes this more fun and engaging for children. So overall, Wandering Emotions offers the benefits of well-being walks with the addition of specialized activities designed and run by trained staff. As 50% of mental health problems are established before the age of 14, our target audience is families with children aged 7 to 12. This aims to encourage conversations of mental health from a young age to help families to confidently provide ongoing support to one another. And our market research found that families of this demographic are interested in our program. So once taken part, families will feel more confident to understand and communicate their emotions and to tackle mental health difficulties if they arise. So by embedding well-being into daily life, we can prevent the children in Lambeth becoming those 1 in 5 with mental health difficulties. There are 4 key factors affecting the scenario in Lambeth. 1, the rate of hospital admissions for children and young people with mental health difficulties are higher than the national average, and there's a lack of access to help. The current solutions focus on treatment and not prevention of mental illness. And there's a negative stigma around talking about and seeking support for mental health. And the family services are on average an unaffordable price of £100 an hour.
We have created an innovative solution to tackle these problems. Our approach is simple. It's highly impactful, self-sufficient, scalable, and accessible. We aim to increase the availability of mental health support by encouraging conversations around mental health from a young age. We aim to break the negative stigma of seeking support. With the inclusion of activities to increase well-being, aiming to prevent rather than treat mental illness. Our walks are just £10 per family, which our questionnaire shows that families are happy to pay. We hope to secure small grants and donations to cover the startup fees. And after this, the money from family will be sufficient to cover the cost of the walks. Once we have launched, we can expand to additional locations in London as we use parks which are widely available and we do not need to rely on the third parties. We also do not rely on technology during the walks, which makes our program more widely accessible to those who do not have easy access to technology. For marketing, we will use social media and posters in public spaces to engage local community. As a team, we are the right people to bring Wandering Emotions to life. Our work experience gives us expertise to run initial walks ourselves. Between Abby and Naisan and myself, we have experience in teaching and mental health, human resources, and graphics. We are excited to take this proposition forward as we feel it's a simple and sustainable program which could have a significant positive impact to support mental health of children and young people in Lambeth community. We thank you for listening, and we are now happy to take your questions.
Thank you. Okay, any questions?
Thank you very much for your presentation and a really interesting idea for how to improve mental health. I was wondering if you could tell me a bit more about the evidence base and what's the evidence that this will be highly impactful, and I guess what do you mean by highly impactful, if you could unpack that as well.
So all the activities and techniques that we will be using on the walk are kind of everyday things that are used within the mental health industry. For example, I use a lot of them at work. I work with children, so I like the ones shown. I'll do those with the kids. So we're going for, evidence ones that have actually been used and shown to help with well-being. Anything?
Okay, Tamara?
So can you please walk us through one example? Like, I'm a mother and I want to apply for walks with my children. So how can I contact you? How the process goes? What's the experience, etc.?
So we'll have a website where you can book. So they'll have all available walks, so you can choose which one you want to take part in. And it will be obviously a arranged time and place, and then everyone will show up. We'll all walk together, and then there'll be stops along the way where we'll do the activities, and it'll be about an hour. We were, part of our thing, we're going to do trial runs to see a reasonable length for them, but we're thinking about an hour. And then potentially a space for picnic at the end where everyone can just sit and chat. And then they go home. So the activities are for families to do together, to kind of create, increase engagement, to teach parents how to do these activities so they can then do them at home as well. So it's very interactive rather than us doing things with the children, it's the parents, so they can learn together.
Okay.
Sorry.
Sorry.
The possibility that between families, we are also aiming to increase the family bonds. If you participate, you will see the other participants, and because this is the price is everywhere is expensive, so the family, if the families can join, and even how many numbers of families, and then we charge £10. So we try to secure the opportunity for the family.
Okay. Thank you very much once again. Now, I would like to kindly ask you to watch together the video with the solutions of the student teams who also solved this challenge, but unfortunately were not able to join us here today, and we will see for 4 teams. We Overcome, Take It Out, Soul Society, and Smarty Play.
So first up, we have Rennie, Julianne, and Dio from Humboldt University of Berlin, who will pitch their solution, We Overcome.
Hello everyone, I hope you are well. My name is Dio, and today Julianne, Rennie, and I are going to present to you a project called We Overcome. All right, so 1 in 5 adolescents report mental health problems. That means, to put things in perspective, in a class of 30 pupils, 6 of them already have a mental health problem, and many of these cases go unaddressed due to the long waiting period for assessment and treatment. Since 75% of mental health problems have already been established by the age of 24, we see the need for an early intervention method to enable the next generation to reach their fullest potential. All right, so what we aim to do is to help facilitate the creation of digital peer support groups amongst youth ages 14 to 19. And each group will be equipped with a mental health first aid training to help guide them in navigating through the discussions and in approaching difficult topics. And the groups will be based on the issues that they are facing, such as ADHD, anxiety, depressive disorders, etc. So it will be the autonomous safe spaces. And other than that, we also provide an AM moderated forum with medically reviewed learning resources. All right, but you might be wondering now as to how it would look like. Let's just imagine that there's young Alex has difficulty staying focused at school, and she's been waiting for about 150 days for the first assessment, and then her friend refers her to WeOvercome. So Alex would then create an account on WeOvercome and then receives a mental health first aid training, and then she would also join a support group after that. And we've already thought of a few safeguarding mechanisms for all aspects of our platform, and that includes, for example, having the possibility of reporting a post and also to flag a crisis. And okay, after all that, after noticing that our young Alex has become a lot better, she is inspired to help others too, so that she eventually becomes a mentor who will be onboarding the new participants. And this allows Alex to help develop self-efficacy and also to help enable WeOvercome to become a self-sustaining platform. All right.
But how do we differentiate ourselves from competitors in this field? Firstly, we focus on high impact while ensuring a low cost for our users. Our solution can be easily implemented and replicated because we leverage existing platforms and use them to their fullest potential. Our closest competitors are Black Thrive and Mind side by side. But what makes us stand out is the ease of use of our product, the range of services we offer, and the quality of our product. Our business model is a subscription service where users can access some of our services for free or decide to go with a premium membership, which gives them access to things like unlimited learning resources and one-on-one counseling. By purchasing a Solidarity membership, businesses or individuals can enable people who usually wouldn't be able to afford those premium services to access those services.
Our team is international, interdisciplinary, and innovative. Between us, we share our expertise in stakeholder management, clinical psychology, user experience, and tailoring content for our target audience of young adults ages 14 to 19. And besides the 3 co-founders, a large portion of our team comprises volunteers. According to a survey we conducted, we discovered that 81% of students are interested in volunteering. And out of this group, close to 94% are willing and able to conduct mental health first aid training monthly or bi-weekly. Finally, here's our product timeline. In our first quarter, we are committed to securing seed funding, developing learning resources, and engaging students from King's to co-develop the platform in a hackathon. By the end of the year, we will be reaching out to schools, training our volunteers in mental health first aid, and launching the web app. We are excited to actualize our plan of creating communities of care in Lambeth through mental health first aid training, which can be accessed by everyone. With your support, let's turn our dream of building a happier, healthier Lambeth into reality. Thank you.
All right.
Next, I will welcome Luca, Millie, and Chloe coming from Aarhus, King's, and Louvain, who will pitch their solution, Talk It Out. So you may start whenever you're ready.
Thank you. Meet Anna. She is an 18-year-old who has just come out and is trying to navigate her way through the challenges of growing up and finding her place in the world. Unfortunately, she has faced rejection and hostility from some people in her life, leaving her feeling isolated and unsure of herself.
But Anna's struggle is not a unique case. Many young people in Lambeth are facing mental health challenges and lack access to appropriate support. In fact, according to the NHS, Lambeth has one of the highest rates of serious mental health conditions in England.
In the generation ourselves, we were able to relate to mental health struggles faced by our generation, especially those between 18 to 25 years old, and this motivated us to create Talk It Out.
Anna discovered Talk It Out, a unique and innovative app that provides a safe and supportive space for young adults to share their experiences and connect with others who are going through similar challenges.
With the first use of the app, Anna needs to complete a quick and easy self-assessment to identify any areas that she may need support with. This feature helps the app tailor its content to Anna's specific needs.
The app, we also have a mood tracker feature, which allows Anna to keep track of her feeling daily and know the trends of her moods.
And we know that online community support is important. So Talk It Out aims to offer an online community and with an option of attending offline events.
But today, Anna chooses to stay in, so the app takes her to the newsfeed where she can browse through posts from fellow users, access forums, chat rooms, and the resource library, which offers her access to a wide range of books, podcasts, etc., about topics related to mental well-being.
And for a nominal fee, she can also access trained mental health professionals through the app, where she can chat with them or book an appointment with them. So what makes us unique?
Our app aims to focus on community and connection, which sets it apart from... Okay, I think Chloe just speak. But so our app aims to focus on community and connection, which sets it apart from traditional mental health apps that focus solely on therapy. Our goal is to provide a safe and supportive space for users to connect with others who may be experiencing similar struggles and find support through peer-to-peer interactions.
So let's talk about the business. Our revenue model consists of two main components, a B2B and a B2C model.
Our B2B model will focus on institutional partnerships, particularly with universities in Lambeth. The B2C model will reach individual users through a freemium model where users can access the core features for free, and then a premium version which offers additional features such as contact access to mental health professionals, passes to expert-led events and workshops, and so on.
With regards to the pricing, following a thorough analysis of the competitors and the survey we ran, we decided to price our app at a nominal fee of £7 per month and £50 per year. And for our institutional partners, we propose to offer 500 licenses of the premium version for an annual fee of £50 per license, but with unlimited access for all their students. So let's move to our timeline and how we plan to execute our business.
Let's move to our timeline. We aim to start development as soon as we secure funding. After the development phase, we anticipate a soft launch period of 3 months and make necessary improvements.
And following the soft launch, we will officially launch the app to the public. And our campaign will target young people in Lambeth with mostly social media, email, and influencer outreach. We'll also advertise our volunteer program to build a team of moderators and therapists. Our aim is to build a sustainable user base and drive engagement, leading to significant growth in year 2.
And now you may have realized that we haven't introduced ourselves yet. So here we are, the creators of Talk It Out.
So Millie is pursuing her postgrad in psychology and neuroscience of mental health. Her knowledge has been a very valuable resource in targeting the needs of the young generation.
Lutza is currently doing her postgrad in business psychology. Her knowledge and experience enabled us to move beyond theoretical concepts and make this project a reality.
And Chloe is studying law for her bachelor's, and her background has been instrumental in informing us about legal aspects surrounding the integration and well-being of young people.
And remember,
if you don't talk it out,
you will act it out.
Thank you so much. Next up is Sahil from King's presenting their solution, Soul Society. So whenever you are ready.
Thank you. Thank you. So meet Joel, a 12-year-old bisexual neurodivergent struggling with his mental health. What Joel needs is support, a network of support, but schools, parents, teachers, NHS providers, they're all arguing for what's best for Joel. And there's actually a huge disconnect between the support network Joel has and what he actually needs. So this is the implementation gap. They all have the best interests for him, and they need to work together for him. Joel is not alone. 20% of adolescents have a diagnosable mental health disorder. Between 20 to 30% of those adolescents have one major depressive episode before they reach adulthood. What do they need? The GMF surveys. So GMF surveys is basically looking at the goals, motivations, and frustrations of a cohort of students or particular students. And what they do is they deliver information using AI to analyze those goals, motivations, and frustrations, and then efficiently delegate and efficiently deliver the relevant resources that are applicable to them in a summary report. And it's not only for students, but also for parents. So the school gives the survey to all students and parents. They identify using AI the goals, motivation, and frustrations, summarizes it, suggests relevant opportunities that are already evidence-based and prevalent in the community, but not accessible to the students and parents. And then the school can take that opportunity to take on those suggestions and apply what suggestions have been made to improve the school. So we've actually been in the process of validating this with two massive student organizations. So we made a mini viable product. We've gone to the Secondary Students' Union of Northern Ireland and the Organising Bureau of European School Student Unions to actually send off this survey. So our timeline with this is we're validating our product, and basically we're going to do a pilot test in one school. I have a communication with my old secondary school in Sutton, but obviously I want to also do it in Lambeth, so we'll try and communicate with that. But I do have a backup school, Sutton, if this is taken forward. And then we'll reach out in 6 to 12 months to all Lambeth schools, and then hopefully push this as a national UK policy to implement this technology in all UK schools, so to reduce the implementation barrier. The business model is that initially when we're doing our piloting, we'll do a funding kind of round, and we'll use public fundraising platforms like Republic and Kickstarter. And also we're going to go and reach out to Eric Collins at ImpactX, which is a massive investing team. And our model is typically a 1-month free trial, but we would use a premium subscription model because it's a software as a service that schools can pay monthly for the service, and it kind of analyze their school cohort goals, motivation, and frustrations to allow them to monthly analyze what the school needs and then look for the relevant resources and implement them. And then we have potential partners, including Microsoft and the Department of Education and the Department of Health, that can collaborate and work together to not only fund this, but implement this as a national policy. Okay, and also GMF surveys, we are fixed and very passionate at being disruptive sustainability champions. And how we're going to do this is that we're going to be creating the AI and being transparent in our governance and our supply chain of how this AI is worked to make sure it's as sustainable as possible. And we actually, by doing this program, benefit a lot of the SDGs. For example, we're promoting good health and well-being by promoting the well-being of students and giving them the appropriate resources and opportunities. We can approach issues like poverty and hunger, gender equality, quality education, and we actually realize in one tool we can cover a lot of the sustainability goals. So who is this team? So the team is me. I'm Sahil. I'm a third-year medical student. I'm a passionate advocate for supporting mental health. I've been campaigning for this and a lot of other modules for students for the past 2 years. And I've actually made contributions to influence UK and Canadian policy. And in those 2 years, I've become more confident in social campaigning. And for that reason, I've gained an extensive network in, for example, Microsoft, policymakers, and entrepreneurs. And my key skills are strategy and creativity. And my whole mood is because of service, I'm very compassionate and I'm resilient, and for that reason I've grown an expert and that network. The only thing I'm missing is you as a team and as these judges. If you help me go to the next stage, then I can progress and I can make a difference. I can make this an actual reality, and after it's validated, we can actually implement it as a policy. Thank you so much.
Wonderful, thank you, Sahil. So next we welcome Minsu from King's College London, presenting their solution, Smarty Clay.
So I hope everyone can see the screen right now. Awesome. So, imagine a classroom of 30 students. Of those 30, there are at least 6 of them likely to have mental health issues, especially in Lambeth. For students, it's the very fact that it's uncomfortable to open up to the parents and their teachers. For parents, it's the waiting times, up to 18 months in NHS according to statistics. And for the teacher, it's very difficult to fairly evaluate vulnerable students in large settings. We've identified that the 2.6 million students between the ages of 5 and 16-year-olds across the UK may be suffering from mental health. We've spoken to parents of 10 to 18-year-olds across the borough, and around 70% would prefer apps that cope with stress and trauma and find it extremely helpful. And we've also identified that 73% of children play the mobile game on a weekly basis. To counter the rising challenges, we've decided to make an app in a gamified setting that identifies tailored support for young people in school-based settings. They will work as is the psychometric tests we see already established across the industries. However, the main issue is that pre-existing apps such as Headspace, Sparks, and Emotiflow are not suited to under 18-year-olds. So there's a real need, especially for children who are autistic. Parents find that they're often hesitant about using technology, fearing they will deter the children from interpersonal interactions. So rather than trying to completely discourage technology, we believe that we can help channel that interest and that fascination in a way that's helping them rather than harming them. And by use of our gamified app, we're actively involved in participating in the entire curriculum as part of the school curriculum, and children can learn ways to deal with situations, including distress and being overwhelmed. And one of the parents have told us in the interview that it will be super helpful in boosting their skills and confidence and giving them a common language with their children, a way to talk about these concepts. Furthermore, after using this game, I'm sure that they'll feel that, okay, I know what to do here, I know how to help my child use the skills, they can calm down and move forward, rather than get stuck and feel overwhelmed. The timeline is as to work with charities, first of all, who may be interested in supporting us in the long term. The next natural step is to liaise with councils to help us introduce our app to schools around Lambeth and potentially beyond. The third stage would be app development. We have an MVP in place. Unfortunately, we can't quite show it tonight. We have spoken to headmasters from 3 different primary schools, and we'll be aiming to run a pilot if this gets approved. Additional funding, since it has been a game of chicken and egg. The schools aren't willing to introduce our platform without any funding in place, so they'll come to have later. And finally, we may have an haptic device rollout, a physical device to complement the app if this is successful in a year's time. Our team is comprised of 2 core members. We have extensive experience in technology, marketing, as well as research in the space of autism and development. And we have spoken to 5 developers, some of who are working part-time professionally from these 3 different institutions. And the grand aim is to have a companion platform for faster, friendlier, and factual diagnosis, which seems to be absent from the UK. Thank you.
Okay.
So first up, we have Brenny, Julianne, and Dio.
Okay, thank you really, really much for your attention. Let's see now testimonial from their associated partner.
That very often services like the ones that I represent, we tend to sit in darkened rooms and decide what is good for local populations. And one of the crucial things that is missed out in that is the very vibrancy, know-how, skills, knowledge and expertise that sits within the community. Having 126 brains devoted to thinking out of the box, thinking about one foot in the knowledge of what mental health is about, but also having one foot in another arena to be able to look at things from a very different perspective. You're all involved in lots and lots of different degree subjects. I never get the chance to talk with geographers about how we're going to create better mental health solutions for a borough like Lambeth. So there's a whole load of degrees from undergraduate knowledge through to doctoral knowledge that you kind of go, let's pile in there, because you will come up with stuff, guaranteed, you'll come up with stuff that I've never even dreamt of. So.
Thanks. So at the end, just allow me on behalf of all the partners to thank everyone who helped in the realization of this whole project. Of course, first of all, our associated partners with their challengers, lead and expert mentors who significantly helped the students in the process of developing solutions, but above all, to the students themselves, who have shown the desire and ambition to contribute to the development of sustainable solutions that will improve the working and living conditions for many. I hope that your entrepreneurial aspirations will not end with this program, but that you will continue to engage and change the world with your innovative ideas. The Circle Youth Challenge is and was a meaningful experience for everyone who has had a part in it, but our mission from the very beginning has been to give you the opportunity to engage entrepreneurially and develop innovative solutions to real problems and feel how the real world works and the potential job market that you might join. We hope this program has at least helped you decide if entrepreneurship is the right career path for you. Regardless of whether it is or not, we wish you the best of luck with your future projects and initiatives. And I would like now to ask our Secretary General, Kevin, to join us and award the certificates to the students that are here with us today, but of course we made certificates to all the students who participated in the program.
Thank you very much. It's the first time for me also to end certificates, so it's very stressful for me. So I will just call the different students out there. I will not have a concluding remark now, because I will do that after the other session that we have. So please, when I call you, you come here and I give you your certificate. So first is Abby Che, and I'm sorry for the pronunciation. It's maybe Shay or Shay, I don't know. Yeah, and I think we yeah, here you go. And you can stay here because I think we will have a family picture afterwards. Yeah. Agbola Jatube Sandra? Sandra? Yeah. That's what I thought, it started with the family name. Congratulations. Akira Furuta? Congrats. Andreas Riesborg. You're welcome. Thank you. Andreja Andrejic. Sorry, my Serbian is not good. It's difficult. You are stuck at the end. Here we go. Congratulations. Andrija Jovanovic. Congratulations. Anja Kompanijek.
Anja.
Anya. Anya?
I can take it.
Where's Anya? She's not there.
She left.
No certificate then. Asa Diabira? Where is Asa? Yeah, sorry. Bien joué, Asa. Czaslaw Petronic? I need some Serbian course, I think. Congratulations. Danica Jakovjevic. I'm discovering your name now, so it's like improvisation. Congratulations. Dujan Mizic.
Malo se spijte. Svi se malo se zgrupišite. Zagrlite se, sedite dole.
Congratulations.
Da, da.
Isidora Kujic. You're welcome. Katarina Stojsavljevic. My God. It's also a test for me. Congratulations. Kirtana Munisami. Congratulations, s'il te plaît. Laila Khaled. Yeah. Congratulations. Marie-Louise Young Bengtson. Congratulations. Maxime Gossens. Félicitations. Milena Gatic. Congratulations. Muskan Tewari. Congratulations. Nala Meite. Nala. Very good. Congratulations. Petar Jovovic. We need a bigger room next time, I think. Congratulations. Sail Ake, or Akwe, I don't know how you pronounce. Congratulations. Sane Gudmundsen. Congratulations. Sarah Petkovic. Congratulations. Sabine Yemi Lee. Congratulations, Jane. And last one here, Vladimir Radenkovic. Yeah? Okay.
They can
Yeah.
sit on the floor, maybe.
A football team then.
Yeah, like a football team. Yeah.
That's really good. You can go further there. And if you agree, maybe the different mentors and those that have been also the member of the jury can join also for the picture, and also, of course, Melina. Maybe you can join also. It will be nice. Please join everybody. The Circular Challenge team.
Yeah, so students, please don't leave because I know you have some recording right now scheduled. So there are my colleagues. Maria is waving right now, and Bojana here in the second row. They need your testimonials, so please join them right now. And thanks everyone once again.
And one service information, please. The person who lost his green jacket, the jacket is found, so it's on the Nicholas.
Da, doći ću ja, idem samo da uzmem čarape.
Hello, everyone. It's my pleasure to join this amazing session. My name is Vesna Damjanovic, and I am full professor of the Faculty of Organizational Science, University of Belgrade. My role in this amazing project is academic chair for University of Belgrade for Work Package 4, Student-Led Sustainable Innovation. My personal motivation is always to encourage students, and this is, let's say, the mission of professor, what we should do. And I will try to connect this, let's say, topic. It's related to the Female Founders Network with the mission of Circle U project. What we want to do, we want to achieve and encourage students to have better competence and provide sustainable solution in order to make Europe, but not only Europe, but the whole university alliance system healthy, let's say, prosperous, and in the end, we want to feel satisfied connecting research with practice, including all stakeholders, teaching staffs, students, society, and all other, let's say, important stakeholders. This workshop will be, let's say, I will invite a lot of people to talk with me because I like teamwork. First of all, we have amazing student who is with us, who, let's say, attend all 4 events that we organize. Mr. Karami from Berlin, thank you for coming. We also have my great colleague from Denmark, Adriana Maria. She is representative for the kitchen, one of the most important, let's say, incubator from Denmark. We will also have Victoria Neji to explain what we did in Paris when we have an amazing event and what we create as a female founders manifesto. And at the end, I also invite one guy, do not have only, let's say, female in this presentation. It's our student from the Faculty of Organizational Science, Rasko Damjanovic, who is a co-founder of the best technological innovation startup, Inclusio, in Serbia for 2022. Why he's here? Because during our work, our mentors for Working Package 4 also provide him a feedback, and it was really useful. That was in June, and now he will present, let's say, successful startup and share with you, because I think it's important to, let's say, share this kind of successful, sustainable innovation example. But at the beginning, I want to thank all people who helped me to be here. Let's say, first of all, Professor Ivanka Popovic, she's ex-rector. We have also Professor Zrnic, who is, let's say, general manager for this project from University of Belgrade. Thank you, Professor, for everything. Also, we have Nikola Savic from Working Package 1, who coordinate all of these activities with his team, and he put a lot of energy of this. I want to thank Professor Melina for leading this, all of us, and helping us to execute all activities that we need in this working package. Also, I want to thank Rector Vladan Djokic, who yesterday at the opening said a really nice word, and Professor Ristic, who now are, let's say, also are part of this amazing project. But we also need to thank our Kevin, who is from Belgium, our General Secretary of Circle U project, for all support that you put and believing in us. Thank you so much. Our faculty is, let's say, leading, not only here in the region, but in the world, because we won a lot of case competition, not only in business, but sustainable business competition. And because of that, we had a meeting, let's say, of the CIMORG International Symposium in June 2022. And I just want for you to see the video that we arranged with all academic chairs was present and Professor Melina there. That was the video from the conference. I apologize, something happened. And now I just want to also thank people, because all of this project exists because of this, let's say, the teamwork that we are creating together. And we have Emily. Unfortunately, she's not present here in Belgrade, but she's from Belgium, really dedicate and help us a lot, leading all activities that we are doing as academic chair, let's say, group. Also, we have, like I already said, Professor Melina and Victoria, who are the leads for the walking package and they provide us emerging support and energy and direction for, let's say, doing all of this. We have our friend Nicolas from Paris, we have Morten from Denmark, we have Duško from King's University, UK, and we also have our friend Taran in Oslo. She's now replaced with our friend Marcus. And I just want to share with you, this is a starting point, what we use. This is something from University of Rennes, from Belgium. And this is how we created sustainable change-making program for students, connecting 3 important fields. First of all, sustainability, entrepreneurship, and for sure, innovation. This is a way how we create for students to be first, because our package is student-driven. In the end, what we provide, not only theoretical knowledge, but also useful example, research article, webinars, and what we also have. We, let's say, had in the end international project work that we present together. This is how we create the course, like including all academic chairs, and also Victoria was with us not only to provide theoretical concept, but also using methodological way of thinking, using case solving and elevator pitch as techniques. This is the final event that we have in Leuven in December, and it was really amazing because we have students who really enthusiastic find a way to choose the case project, real project related to this one CDG. And also they also have opportunity to choose educational project managed by Victoria and Nicolas from Paris. We have great presentation, and we have a jury panel that provide them the feedback, and in the end we also record the feedback video, because we think this kind of feedback video is important for us to improve and to become better for the next, let's say, years to come, to really improve something that we are doing. Now, I will just shortly tell you something regarding the Female Founders Network. And after that, I will just ask, first of all, student and Victoria and Adriana to share everything, and Rasko will be in the end, okay? What we identify as a main challenges for the female, let's say, founders. First of all, they don't have they have insufficient knowledge, and also what is really important, lack of passion. To be successful startup founder, you need to have your purpose. What are you doing and why are you doing this? Also, what is a challenge for women? They usually adopt their own abilities and decision because they have multiple roles in the life, okay? And how we can overcome this with self-confidence. We need to practice, encourage each other, and also using the good example and listen to failure in order to become more self-confident and find our main strengths in order to invite other people in the team who are better than we are. And last but not the least, there is always problem raising the funds and networking skills, and we can all create this establishing a strong female founder networks, not only on the students that are at the beginning, but also some successful founders that already, and women executives that are successful, that they can share help in mentoring and so on. Okay, my great honor now is to present our student from Berlin to share with you experience from all 4 events. Please.
So, hello everyone. I'm Satayesh Karami. I'm a philosophy student at Humboldt University of Berlin. I'm so happy to be here, and I would like to not take a lot of time after a long day. I would just briefly explain about my experience with Circle U, which was a really unique experience because of the Circle U vision. And I would like just to show you some pictures and explain about what I did at Circle U. So the Circle U vision is that 9 universities from Europe are gathering together and work in an international, interdisciplinary projects. First of all, Circle U provide for us a really wonderful platform to be together and to work in a real practical project. We learn at university on lectures too many knowledge, we have too many written notes, but we never had the chance to experience what is actually knowledge to policy. And that's what Circle U does. We have the platform to do and to experience a real project in academic position. My first experience with Circle U was in Oslo, Norway, August 22, then Paris, October 22 in Hackathon. We were in March 23 for the Female Founder Program in Paris again, and then Belgium twice at November and December 22, and the last but not least, the Serbia this year and now. So Oslo was the first experience with Circle U. It was a wonderful trip. You can see the North Sea in Oslo, and that's all because of the Circle U. We had the summer school there with the theme and subject, evidence and democracy in times of crisis. But it's not only a normal summer school, it's a platform for you to really work on a project, have an idea to present and to pitch, and to be like self-confident. And I don't know, I think someone left, but we have Boris, who is at the front of the picture with the brown coat, and he is also a student in Serbia, and he was attend here, but I don't know where is he, but yeah, it's fine. And the second is Paris Hackathon, so we have dear Victoria here in the picture. It was a really interesting hackathon. We have 24 hours time to find a solution for a really complicated problem, which was about the relation between patient and doctor. That's my team with dear Ben, our facilitator. And the next one is, Vesna just told about the project, the Changemaker program, which was first in online platform, about 11 weeks, webinars and sessions and group working. And then we had the chance to meet each other at Lubananov. I hope to pronounce it right, but we worked together and we developed a program with one of the CDG and sustainable work. And then we had Paris with a really wonderful energy, like you see in the photo. And we have here dear Vesna, Melinda, Victoria, Nicholas in a Female Founder Program. And all other the team, we had Alexandra and then Melinda here. Alexandra, the last page I'm in. And then by a Female Founder Program, we create a student-led female founder program, and then initiative to work on the values and then create a really big network and helpful network for together. Then we had a video from one of our projects. And that's where Alexandra is on it. Hi.
Hi, I'm Satayesh from Germany.
I'm Isabella from Denmark.
I'm Lisa from London.
I'm Selenia from Belgium.
I'm Alexandra from Belgrade.
I'm Ziqing from China. And we are
Circle your herrings!
Do you want to try a Belgian waffle?
And save the world at the same time.
The reason why I'm here, actually at the university we don't have opportunity to meet each other from other countries, other universities and other persons, and we are here to have a real practical experience on sustainability.
So during this course we had a lot of different webinars over 10 weeks with different professors, and it was really good to get insight into different ways that we can tackle sustainability with all these different types of knowledge. For me, I study nanoscience, so it was really good to learn about business modeling and try something entirely new.
So one of the things we have in common with all of the group members in our team is that we are all certified foodies. We are serious about food. And food waste is actually one of the most targeted UN goals.
That's why we decided to tackle food waste. With our group, we've been meeting every week, learning from each other's fields of studies and knowledge, to create this program, including everyone's abilities.
We are in Louvain-la-Neuve today and for 3 days with all the girls and all the people involved in this program. So we are here to pitch our business idea in front of a jury made of professors we already met during the program and invited people expert in the field of sustainability. And how can you define your experience in one word?
Insightful.
Innovation.
Exciting.
Challenging.
Eye-opening.
If you like challenges and solving problems, don't be shy. Join us next year.
Thank you very much. So I would like to invite all of you, all the students, all the staff to join on Circle U events, summer schools, challenges, I don't know, everything that belongs to Circle U, because that's the future of our world. Thank you very much.
Okay, so the floor is mine, and I'm thinking, should I be on the floor? That's the question, as I'm not very comfortable with this lecturing position. We're supposed to be innovative, so... All right, I'm going to peek. I will need to peek, but anyway, I prefer being on the floor. So actually, what I'm going to talk about today is the Student-Led Female Founders Network that we have just established. Hello, Anya. Thank you. And first and foremost, let's just talk about our vision. So the vision is, of course, empowering young female entrepreneurs, future innovators, but also scientists who are going to be entrepreneurs, meaning working for a big company, but who will still need to have entrepreneurial skills, because once you're in charge of a project, you need to be able to publicize it, to recruit your team, etc. So this is one thing. The other thing is, of course, sensitizing students to the entrepreneurial mindset and basically just building up an entrepreneurial culture within our universities, especially for women, because we know especially that young women face challenges other than their male counterparts, including leadership skills, self-confidence building, and networking, business plan building, etc., etc. Another thing is, of course, interdisciplinarity, understanding that in our world, a well-functioning team requires people who have different cultural and disciplinary backgrounds. That's what makes things work. Finally, of course, the key idea is to create a European space, open our students up to this European space, but also allow them perhaps to scale up their businesses within the European space. That's what it is. And so, before we go west now, to start our Female Founders Network, we have organized a retreat in Paris that took place at the end of March. This was our first physical meeting after 4 or 5 online meetings. And here is this video that will sort of depict the experience that we've lived together. So enjoy.
It is a well-known fact that women encounter gender-specific challenges when choosing the path of becoming an innovator. To mitigate this issue, students exchanged ideas with researchers from the female entrepreneurship field who explained current scientific data. Students met inspiring female role models, women with leadership experience, successful founders of startups, women in science, and academia who shared their experiences.
I always knew that I wanted to be a scientist and a researcher, but I don't know why exactly, but I knew, so I just go there 100% and follow the path that I choose, and despite everything, what people told me or not. And now I'm just take a step forward and be proud of what I accomplished.
For me, one of the key takeaways from this Female Founders Retreat in Paris would be student empowerment. As someone who thinks a lot about the future of higher education, I often tell myself that we need to learn how to empower our students, and that will come through opening them up to Europe, the European space, and allowing them to think about their future roles in European society as European citizens, change makers, stakeholders in society. And that can only come through us educators, allowing them to acquire the necessary skills to do so, the necessary entrepreneurial skills.
Really the idea to be able to scale up at the European level when you have an idea, and if you can leverage on experiences of your peers.
What are the facets of female entrepreneurship and also the challenges?
Skill-building workshops allowed students to reflect on their strengths, to build self-confidence and leadership skills.
From my perspective, I would say networking is a very big skill that will get you very far.
When it comes to Female Founders Retreat, it's really big. As we mentioned, two very important things, collaboration and diversity. It's really very important to hear each other, to learn from each other, and to empower all these girls.
A meeting and questions and answers with our non-academic partners from Station F, the biggest European startup hub, was organized to discuss their programs for young entrepreneurs.
I don't always like to use the word pitch, but simply just practice presenting your idea. Also, sometimes we have students or researchers that are a bit afraid of presenting their idea because they don't want to give away too much, but then practice telling something without giving the essential technology away.
Building on the results of the first day, it was time to officially create our European-wide student-led Female Founders Network. Students brainstormed about their common values, their action plan, and created a Female Founders Manifesto.
And the second take-home message would be the importance of collaboration, mutual support, and diversity. This Female Founders Retreat was organized in Paris, but actually it was put together by a team of students, academics, and non-academic stakeholders who all have very different disciplinary and cultural backgrounds. And I believe that the future of a more collaborative, more innovative Europe hinges on our capacity to use our diversity as a source of inspiration and creativity, all the while respecting our mutual differences.
It is the founding document of a network that will serve as the cornerstone aiming to strengthen the innovative spirit within our institutions.
For now, I can say that I've learned a lot, and I've met wonderful women, very passionate about what they are doing. So I'm grateful for this opportunity.
We are women innovators creating the future face of Europe.
Please just be authentic, be yourself.
Challenges maybe, but amazing challenges.
Go forward and don't be stopped by anything else.
Initiative, for sure.
Thank you guys. We'll send you the manifesto. So this was our Female Founders Retreat in Paris. And the fact of the matter is, the aim of this first physical meeting was to create a manifesto, meaning gather our core values and also to think about our action plan, right? Our Female Founders Network is supposed to be student-led. So we allowed our students to think about what they want to do with it. And this is what came out of it. No. I think twice it would be a little bit too much, I guess, right? I think there's another one before that. So in terms of values, of course, diversity and inclusivity came out on top, including cultural, social, and disciplinary diversity, but also creating a support system for our young female entrepreneurs and innovators seem to be very, very important. They want a network that allows them to grow personally, to self-develop themselves. That's very, very important. And also it should be change-oriented, dynamic, and also innovation and solution oriented. So certainly not top-down, and certainly not about maintaining the status quo. That's our aim, certainly. And of course, they would like to collaborate on sharing best practices across Europe because our entrepreneurial practices within university are pretty different. And of course, they want to become stakeholders in society already as university students, meaning they would like to think about the future and shape the future already while they are at university. And I can see Satayesh saying yes, good. And now finally, the action plan they came up with. Of course, this is just a brief summary, and very soon we're going to get together again with these students and formalize the information I'm sharing with you. Number one, we are planning, or they would love to create a platform, a European Circle U platform, allowing them, for this Female Founders Network, allowing them to be visible within academia, but also to be able to upscale, right? Because if you're visible, you're able to recruit new students. That's the point. But also visibility outside academia, meaning being able to contact investors, work with non-academic stakeholders, and that platform is necessary for that. Finally, this, of course, platform would allow them to constantly, permanently network with each other, find new teammates, show and talk about their projects. The other thing is, of course, so this was the platform, number one goal on our action plan. Number two is sensitizing and training. So our students are saying we need more regular skill building workshops, most probably online with some physical meetings here and there. Perhaps a hackathon specifically targeting female entrepreneurs. And why not a pitch contest, but that's kind of close. We'll have to decide the format. And then they would love to have an entrepreneurial internship, allowing them, one that's really focusing on female entrepreneurs. And of course, collaborating with non-academic partners so that internship shouldn't just happen within university, but in collaboration with non-academic partners. Finally, third, so this was about sensitizing and training. Number one was the platform, and number three is really creating a sustainable network that remains with us. That's something that just doesn't work in a project mentality, but something that's permanent. And for that, they would love to have biannual meetings within our universities, perhaps have a Circle U Female Founders Day. That's on a specific day, and that's celebrated within Circle U. And why not establish a buddy program with alumni or with senior students so that we can help up-and-coming young female entrepreneurs to integrate our network. So this is our current action plan. This is what we're planning to do, and hopefully it will happen, and it will allow us to empower our young female entrepreneurs. Thank you.
Thanks, Victoria, for such a great presentation and that you sum up everything that we did in Paris. Now it's my great honor also to say thanks to all people who also was with us. I think Jessica wasn't here, but she was really active also from the King's College London. We have Katja Brunner from Germany. Adriana is here, and also Emily was really active. That was the group that coached students, helped them with workshops, and it was really amazing teamwork. Okay, now we have, oh, sorry, something happened. Victoria, stay here. Okay, it's my mistake. But Adriana is coming for Aarhus from Denmark, and she will present the kitchen, and it's my great pleasure for you to share a wonderful experience.
Thank you, Vesna. Yeah, so Vesna gave me the chance to talk about the kitchen, and of course I took it. So even though it's late in the afternoon, bear with me a moment because I would like to introduce our university incubator. Some of you have heard it before, so I apologize that you need to go through it all again, but yeah, it's good with a little freshening up your memory on the kitchen, of course. But first we have a little video.
Netværking.
Innovation.
Vidensdeling.
Rådgivning, støtte og en god café. Du kommer til The Kitchen med en idé, og du behøver ikke nogen forretningsmodel. Du behøver ikke rigtig have nogen idé om, hvad du vil med idéen.
Jeg tror, det er virkelig vigtigt, når det er, at man vil starte noget op, at man ikke skal være bange for at springe ud i det, for der er altid nogen, der vil omfavne en.
Hvornår er det rigtige tidspunkt at blive iværksætter?
Mens man studerer.
Mens man studerer?
Netværking.
Yeah, once again, we don't have to see it twice. So we have this student incubator, not only student incubator, but incubator at Aarhus University, both for staff and researchers and students. And what I feel is that our incubator is doing a lot of the things that also the Circle U program is trying to do with innovation, entrepreneurship, and solving different challenges. Of course, that's something that the students are trying to do within the companies that they're trying to create. But also just even though that they're trying to start up a company and might not succeed, that is completely fine with us because we believe that they are still gaining tons of skills. And that's also kind of the Circle U philosophy, I guess. So agency is important. They create skills to be change makers, and we really like that and try to enforce that in the kitchen. So we are located here at the old hospital kitchen in Aarhus. That's why we are called the kitchen. And in a while we're going to move to the laundry. And don't ask me if we are going to be called the laundry building. I hope not, because it took us a while to build a brand in a large university like Aarhus that people know that we exist and come and join us. So yeah, thank you very much, Vesna. This is some of our numbers. Like I mentioned, we're an extracurricular activity mostly. But we also do internship in your own company, which is a ECTS point activity that you can engage in with the help from us. So we make sure that people that want to go in internship in their own company, they don't sit at home on their bedside feeling all alone, don't know what to do, but we help them create structure, giving them advice on how to get started, and then becomes a part of the curriculum. So of course you can see these numbers, but they're constantly changing because people realize, oh, I don't have time for this startup that I wanted to do, so I'm not going to do it. And then we have new people coming into the incubator, so it's really difficult even for us to keep track of the numbers. But this is an estimate of what's going on right now. We also have a great, we have a great cafe that's run by a student, and I know that tons of things here in the Circle U, student-led, and that's a really helpful thing for us because then they can be our collaboration partners in this process. Yeah, thank you. Yeah, you can proceed. Yes, and this is an example of some of the workshops that we are doing and hosting. So we do like a membership to the incubator. It's free, of course, because we are part of the university. And like I said, it's both for researchers and students. So, but we do want them to sign into the incubator so we can kind of keep track on who's there. And the people who are part of the incubator, they can come and go as they please. But the people who are not part of the incubator can still come and join some of our workshops and can join the public cafe in the opening hours. And hopefully one day, when they feel comfortable about it, they will join us and try to do some of the ideas they have and maybe turn them into a startup eventually. And like I said, you can see we both have things on brand building, creating a strong team, which I believe is really important also when you look at it from the female founders context, because we can see that that's something they really request. We also saw that in Paris. And negotiation techniques and tons of stuff that is really important as an entrepreneur. Yes. Yeah, and then, like I said, network. We did like a network weekend, both for men and women, and that was quite a success. And we also saw that as a part of the Circle U activities. And you can change, yes, and we did a women's startup retreat weekend. So what we learned from our great colleague Jessica from King's College is that we kind of have to adjust and use the right words in these contexts also to appeal to women. We need to communicate in a new way. We cannot, and that just not only goes for women, that can also be for students and people, staff from the humanities. They don't necessarily always want to hear growth and scale-ups and that type of language. That's our experience in our incubator, and we're actually able also to back it up with some of the research within entrepreneurship. Yeah, you can change. Yeah, and that's a group photo from our weekend. That was great. And what has come out of this is also that the students have created their own network. I think they are thinking about changing the name, but for now it's Women Startup AU. And one of the things that we did in collaboration with them was an event where we had this woman from Shark Tank. I don't know if you have that program here, but she presented, and this is also important for us to have role models, so people have the women have somebody to look up to and see how are they doing and how are they creating a business eventually. So it's also quite important for us to stress that we have a very supportive ecosystem in Denmark, which I think is really important because the funding opportunity is also something that is a bit difficult for women, as it seems. And if you look at this one in the middle up here, you can see that it says female founders initiatives. So we have like initiatives that both goes for women in Denmark, but also in the Nordic. And also some of it is EU projects. And we really try to also use those possibilities in order to help our women start up the companies that they want to do. And I could also hear from the presentations here on the challenge that some of them were already doing their business models and were thinking about how do we get investors and soft funding and all those kind of things. And that is exactly what we are helping them do. Thank you. Yeah. So this is some of the things that we have looked into, but also based on the research as of now, as to how to increase the number of female entrepreneurs. And like I said, so we are trying to work with role models. We are trying to help them get access to finance, and also trying to change the way we as an incubator communicate. So it's not only about, we have also done workshops about how should you pitch and how should you maybe talk about things in a different way, but it's also important to look at ourselves and not only say change the women, but we should also change the system, and we are part of the system. So we also need to think about how we communicate. And then, of course, network, and we've been working both on that in our incubator, but also in the Circle U Alliance. And then education, and that I think was also some of the things that Victoria talked about, having the right skill sets. Most of the time, we see that a lot of women, they do have a great skill set, but they don't believe in it. So the education is very much about creating awareness of that, believe that the skill set you have is actually exactly the ones that you need. So that's also one of the workshops we have done have been about the imposter syndrome, and I believe that they also did that in King's College, and I think that in King's College also men wanted to participate, and we experienced the same thing at Aarhus, and I think that's a really important point there. Yeah. Thank you. I think that was about it. Yes, and if you would like to connect with me on LinkedIn, like I said, I'm Adriana, and you can, do the QR code, and that will take you to my LinkedIn profile. And if you have any questions about incubators or our part in building and trying to help female founders, then please write me, and I'll try to answer as good as I can. So thank you for your time.
Thank you so much, Adriana, for showing us such a great example. I think it's useful for all of us. And now, let's say my pleasure is in the end to present one of my best students. I will just tell you that he, let's say, won the second place at CBS in 2019. He won third place in Porto, also creating the startup community for one, let's say, international company. And he also won the third place in Hong Kong, solving the case of sustainable finance for Alibaba startup. Please, Rasko, show your company, and I hope everybody will enjoy.
Thank you. So no need for introduction after Vesna introduces you. It's always much more that anybody would say about themselves. I'm here as a part of the Case Study Club and Business Case Association of Southeast Europe, as well as a co-founder of Inclusio. The first part of my life during my studies helped me go around the world, compete with all the different universities, and get knowledge on how to implement and how to create innovation. After which I had a brief stint in innovation consulting and decided to implement those innovations by myself on my own companies. So it helped me a lot to learn and grow and gain experience before building something. Inclusio has started with my colleague from Faculty of Organizational Sciences, Bojan Martinovic. He's an amazing guy. He's visually impaired, but he has gone through that with such power. So he was a student of our generation, perfect GPA. Then he was on Polytechnico with a full scholarship, etc. So during all his studies, he was working on a solution to the problem that he had, and that is accessing business branches and business services around the world. So banks, retailers, groceries, whatever. And after he came back from Italy to Serbia, he reached me out and said, I have a solution. I know the problem. I think I have the solution. However, I don't want to raise money, put it in 20, 50 locations and be done with it. I want to create something that can grow sustainably, that can grow organically, and that can cover the whole world and help all the people. I immediately jumped on that idea because it's an amazing opportunity, and it was a big challenge for me to work on something such as social enterprise. The goal here of today for me is to pitch the company really briefly and then to go through some things that are very, very different with sustainable and social enterprises compared to the, let's say, for-profit and regular businesses. So, people with disabilities are facing barriers when they're reaching out the business branches of the objects. So that's rotational doors, that's double doors, crowded places, huge places. On the other side, companies and institutions and employees there are willing to help them. However, they do not know where they are and what kind of problem are they facing and how can they help them. And it's not a small group of people as we might think. According to the World Health Organization, there is 1 billion people with some form of disability, 700,000 in Serbia. And there is a lot of investment, and the investments in accessibility and inclusion are growing around the world. So there is money that is being poured to help people. To tackle this problem, we have created a very simple platform for users and for the clients. It's on one side, users have the mobile app that they can use to find objects that have Inclusio implemented. They have the opportunity to see what kind of accessibility is there in the object. And most importantly, they can reach out to the employees there through the app. The app is completely inclusive and accessible for all kinds of disabilities. On the other side, we have a client system that we install with the clients, so banks, retailers, or whoever, and then employees know where the user is and how can they help them. There are other companies tackling this form of issue. However, all of them are volunteer-based. They provide virtual assistance, and they are financed by users. we are complementary to them, so we're not competing with them because we are there and we provide professional help to employees, we provide physical help, and we are funded by the clients or our business partners. Our early adopter user is a 15 to 35-year-old who is proud to be independent despite the disability, who is using smartphone with internet connection. On the other hand, we have companies that are working through business branches that are already investing in CSR and that are part of an organization promoting CSR. We started in Serbia and Montenegro, and we're looking to scale to European Union. We already have the paying users and paying clients in Serbia, and we are planning a big launch in September with several private companies, of which OTP Bank is already our client. As we said, our business model is to be always and completely free to the users or people with disabilities. And on the other hand, we are charging our clients per monthly fee per location. We have gone through a lot. So in these 2 years, from the very humble starts with a small team through MVP development to the growth and the promoting and improving the application, pilot projects, and now in 2023 we're looking for a big launch in Serbia and expansion to European Union. In the European Union, we're looking to partner with national organizations of people with disabilities as well as any kind of potential clients. We have the whole team that is completely independent, that is working full-time on this, and that is available to develop this and to improve this in-house completely. Thank you. So the key things that I want to address here is, after the pitch, are some of the stuff that I noticed that has to be changed when there is a social enterprise in question. So let's go from the beginning very quickly. This is very important. Usually when you have a social enterprise, people are expecting a very, very small group of people, when usually it is not. So it's very, very important to address that you're addressing a huge number of people that need some kind of help or assistance or whatever it's needed. Also, what is expected is that there is no money in there and that you're asking for part of something small, but usually you can provide an information that there is money that is already being put into this. Very, very important part, and maybe the biggest difference when the social enterprises are in question and sustainable businesses. Contrary to the profit businesses, it's not a zero-sum game. So in the profit businesses, it's fine to say why are you better and how are you going to take customers away from your competitors? How are you going to take the money from them? On the other side, there's no need for that in social business. So as a social business, your goal is to help as many people as possible. So you don't have to compete with anyone. You have to build complementary solutions. So when you're talking about competitors, you can say what they're doing and how are you complementary to them. How are you going to build up on what is already there in the market. You don't want to take users from anyone, and because that's going to be a waste of resources when you're talking about sustainable businesses. Finally, maybe the most important part and the biggest misconception is that sustainable and social enterprises should not be making money or be profitable and should be working and living on grants. It's very, very important to create a stable foundation of financing. You can go for grants for the development, for the growth, for the initial stages, but it's not sustainable and it's not possible to work and get grants year after year, year after year. You will stop and plateau at one point because nobody's going to give you again and again and again for the same thing. So it's very, very important to find someone who is going to be willing to pay to cover most of all or most of your costs. So how did we do that? For businesses, we moved beyond CSR. So the logical thing is to say, okay, we are doing something socially responsible, there are CSR budgets, they're going to pay us. However, 90% of those budgets are already allocated. They have the organizations that they're already supporting, that are doing something good, that are nationally or internationally recognized, and you have to move away from that. So the second part that we moved away is the marketing pillar. So we said, okay, besides CSR, we can provide you with marketing benefits. How? we have contacts with organizations of people with disabilities, national organizations. There is X amount of people, there are hundreds of thousands of people that are members. We already have a collaboration with them. If you work with us, we can directly communicate to hundreds of thousands of people that you are doing something for them. So it's a direct outreach through us. So we built a marketing pillar. However, we built a business pillar also. In our case, we did a research that showed us two very important things, that 80% of people with disabilities would use some business branch more often if it was completely accessible. On the other hand, they said 85% of them said that they would change a brand if there is another brand in the same brand in the industry that is helping them more. So with these two of data, we went to the businesses, and that is when we started to thrive and started to build, get new clients. Because we showed them, okay, it's not just CSR, you will have amazing marketing results, and there is a business case with this. So people are going to come and use your business more if you have a solution like ours. So it is very, very important to build both marketing and business, or whatever case can you build besides CSR, because just going for CSR, it's repeatable year after year, it's very, very hard to grow like that. So that would be it for this part. Do we maybe have some questions, or we can conclude it? That's it.
Thank Rasko for presentation. His startup got the best sustainable innovation. His startup got the best technological innovation in Serbia from 2022. I just want to mention that our goal is to learn from our student, okay? And this is, let's say, the new term, reverse mentorship. I am just glad to have all these wonderful people who share everything that we did together. Thanks once again, Professor Melina. Thanks, Kevin, for supporting us, and Professor Zrnic, and all of you that are still here. And I want to tell you that we will continue building educational excellence. Thank you so much. And also, a colleague from Belgrade told me that we need to fill in the feedback something form, and maybe Melina told me that Kevin should conclude it, sorry. Kevin, floor is yours.
Thank you. Well, I'm not sure that I'm able to conclude, and I will not be so long because I know that we have a long day. But I would like maybe to come back to what I said yesterday. And as I told you, the first university that I went to when I started in Circuliu was the University of Belgrade. And you remember, Melina, that we had an interesting discussion about VP4. Because I think, and it's not a secret or nothing, but it's true that I've been challenging even now to understand exactly what we will do together. And I must admit that I'm just so amazed of this day that we had together. Because I remember the discussion that we had about the Circuliu Challenge and how to implement that, how to develop that, etc. To be honest, I would not have expected the student to come with such ideas, and I was really amazed of how developed they are, and that there are some are really kind of ready for being developed and really, you know, on the market. So first thing. Second thing, of course, the female founder network, or maybe I heard that maybe we'll change it to the woman founder network. I think it's like one of the essential elements of what we are doing in Circuliu also. It's true that we have been concerned until now about what we are doing in terms of education research, through the knowledge hub, through with the academic chairs, etc. But I think that also we have to work on what we want as an alliance that is inclusive, and how we can help also students, and especially maybe disadvantaged students in a way or another, and especially women students and women entrepreneur also, to have a leverage to Circuliu and also have this possibility to grow in their own life and in what they are doing, also contributing to the society. So I think that's really crucial. And I was so happy to hear that, you know, to give the example of one student that have benefited so much from what we have offered in Circuliu. And to be honest, I remember when I started in Circuliu in September 21, and it's not a joke, but it's true that 5 months after, I said to some colleagues, what I'm doing here, nothing is happening. A lot of meeting with nice people, indeed, but not really, impactful action for students, for researchers, for academics and staff. And you are an example as the other student that we have seen this afternoon presenting their pitch and their ideas for the Circular Challenge, that yes, things are happening. And we see that, and for me, the breakout point was maybe last summer when we started with the first Circular Summer School, and afterwards, everything was like, popping up here and there. And I remember now that from time to time, I'm really happy to receive the message about an activity that was not aware about that, and I'm happy about that, because I think that, if it's something is happening from bottom up and a lot of things are happening now, I think we are succeeding in what we are doing. And maybe my last point is that, again, for me, CircleU is not a project. I was saying that to our colleague in Aarhus. I think that CircleU should be a dynamic that is also, inviting the Nine University to be even better in what they are doing. Not only in educating and on, providing research, excellence research, etc., but also really on impacting the world and what we are doing so far. And so I'm so thankful to all the colleagues, especially here today. We heard a lot about the student-led innovation, but those that have been helping them, and I think that you really, need a big applause for that. I think, thank you for that, and all the students also that have been there. And last point, you know that we are arriving at the end of the pilot phase, as we said. A lot of things, and I'm happy we were not so bad into that, because in the proposal that we have submitted to the Commission in January, a lot of ideas that we are proposing, of course, are already there. And we will continue, of course, to support student-led innovation. We want to establish what we call the incubator, also for CircleU. We want to continue the work on female entrepreneur, women as an entrepreneur, women student also. We want also to, and I think it's important to develop a real strategy and action for equity, diversity, and inclusion. And I think it's really important also to think about the diversity of our students that we have in our Nine University. So I think that honestly, you know that I'm optimistic, but I think that we are on good tracks there. And last, maybe Cole, I know that many students have left already, I think, but maybe enjoying the sun. But I'm also turning to you, at the other students. We will have in the next phase also what we call CircleU ambassadors. So basically, we want to use you even more, those that have been also enjoying CircleU, to maybe, spread the good words about CircleU and make sure that other students can also benefit from that. We had a lot of students today. But in fact, there are almost 500,000 there waiting for CircleU also in a way now there. We are Nine University with 500,000 students. I'm not pretending that we will reach all the students, of course not. But I think that we need to, in a way or another, I know we cannot use all those words, but we need to scale up a bit what we are doing, at least. And I think that you will be crucial, you will be essential, those students, but also the academics and the admin staff, to maybe reach out more people there. So to finish, of course, a big applause and thank you for the CircleU colleagues here in Belgrade, especially Nicola and the team there. I know it has been a big work, I think, for organizing the 3 days. We still have a date tomorrow, and it will be a really important one because we will have the visit to the Scientific Park, Innovation Park of Belgrade, and I think it will be very crucial also. And tomorrow we will even, I would say, tackle more the research and innovation part of CircleU. As in the afternoon, there will be what we call the Inter-CircleU Prize ceremony, where basically we have we are awarding a prize to transdisciplinary research projects that are run into CircleU. So please, if you stay in Belgrade, join us for the final day tomorrow. And thanks again for all the work done, and I'm really looking forward to continue to work with you. Thank you. And I don't know the practical info, maybe Nicola?